The Fed15 podcast is presented by Serving Those Who Serve, a financial planning practice serving federal government employees and retirees all over the country. This podcast is for informational purposes only and is not intended to be taken as financial advice. All listeners should consult their personal advisors before taking any action. The opinions expressed by our hosts are their own and do not reflect the views, policies, or position of either Raymond James or Serving Those Who Serve. Securities are offered through Raymond James Financial Services, Inc., member FINRA SIPC. Investment advisory services are offered through Raymond James Financial Services Advisors, Inc. Serving Those Who Serve is not a registered broker-dealer and is independent of Raymond James Financial Services, Inc.
Welcome to the Fed15 podcast, presented by Serving Those Who Serve. Each week, we discuss the latest news and info that Feds need to know in 15 minutes-ish or less. So whether you are a seasoned federal employee or just getting started in your career, we've got you covered. So grab your coffee, your energy drink, your green juice, whatever gets you rolling. Kick back and we'll tell you what you need to know but might have missed. We're your host. I'm Dan Seif, and I am joined by the radiant and redoubtable Katelyn.
Hello, everybody. We have a very exciting episode for you today. We are going to be talking about some interesting topics. Dan is going to talk to us a bit about rural health changes, kind of rural ecosystems for healthcare, and some things that retirees should maybe keep an eye out for if they are planning to retire to a rural area. And then we're going to talk about a topic that is of immense interest to feds and non-feds alike, the Backdoor Roth. This is kind of a buzzwordy term if you do any research online about investing and things like that, and it's often misunderstood. So we're going to talk a little bit about Backdoor Roth, how it actually works, why it matters, why it may be something that you may want to consider. But before we get there, Dan, I want to retire to a field in the middle of nowhere where no one knows where I am and civilization does not exist. What are some things that I should think about?
Okay, and for everybody else not looking for a reclusive life, let's talk about rural health care, because where you are imagining might not seem like a rural area to you. For example, down in your neck of the woods, Katelyn, Smith Mountain Lake. Okay, beautiful area, but you go a little ways away from the lake, and yes, you are indeed in rural. And that's what we're seeing more and more. We're seeing these wonderful lake and reservoir estuary communities pop up, but there's not a whole lot else around them. So what does that mean for our feds that may be dreaming of that lake life, but you're actually in the middle of a rural state? So let's talk a little bit about rural healthcare issues. Since 2005, 200 rural hospitals have closed. That strikes me as a lot. What do you think, Katelyn?
Yeah, this is something that we see a lot in my area. So technically I technically live in a city, but I am in a rural area. And I grew up out in the county outside of my city, which is even more rural. And unfortunately, there's lots of reasons for this that we won't get into on today's episode, because then it would be like the Fed 3.5 hours. But, different legislation, different changes with insurance, different changes with how healthcare is handled. Unfortunately, those changes put inordinate amounts of stress on rural hospital systems, which are typically underfunded to begin with. And so anytime we're looking at any kind of significant Medicaid revisions, often the rural hospital spaces are where you see it first. And I say this as somebody who has a family full of healthcare workers, so very familiar with those impacts there.
So possible ray of hope, bright light here. CMS launched a $50 billion rural health transformation fund that is targeting to take place between 2026 and 2030 to support rural hospitals, address workforce shortages, integrate telehealth expansion. Now, the tricky part is implementation varies by state outcome depending on local policy decisions and hospital leadership. Okay. Medicaid funding reductions will continue while many rural hospitals face financial strain. So this is a really important thing to be taking place. Some regions may see improvements while others could experience continued service reduction. So it is, just like Tip O'Neill said, hopefully most of the people who watch this will at least remember the man's name. All politics is local, same type of thing. So the growth of rural emergency hospital model, emergency and outpatient care, but no inpatient beds, could also impact your availability for care where you are. And telehealth expansion is continuing apace across the country in all areas, but services and hospital offerings can shift quickly. So we always try and give you, another one. Check the other places that purportedly help feds and see if they're covering stuff like this. Guaranteed they're not, and we're proud to do so. But we also get to the nuts and bolts. So how can you evaluate your local care system? So confirm whether the nearest hospital to you is a full acute care facility or has been converted to a regional emergency hospital status. So that means it could have fewer things. Review the hospital's financial health and available services. Believe it or not, that stuff is publicly available a lot of times. But available services, is there emergency care? Is there obstetrics? Oncology, imaging. Now, admittedly, our retirees might not be thinking about obstetrics that much, but sadly, oncology could be something that you're encountering. Check out your state health department. Many of them have dashboards and hospital community benefits reports to get you that data. Now, here are the key questions to answer. If you're looking at going to an area, is that hospital financially stable? Do they accept FEHB and Medicare? Does Medicare recognize and accept them? Are specialists accessible without major barriers? Okay, don't let the baby face fool you, folks. My next birthday begins with a 7. So I am starting to think in terms of, if I get referred to someone, I don't want to wait 6 months, because it hits a little differently at the older ages. Take a look at your logistics, determine what your drive times are going to be for urgent care or dialysis, heart care, stroke treatment. Identify backup hospitals if the services change. So in a lot of cases, and it's an important thing to understand when you make your healthcare decisions, in many cases, original Medicare with some Medigap coverage often provides broader provider access in rural areas. You've heard Ed Zerndorfer say it over and over again. Your FEHB can function as a Medigap. Now, I'm not talking about change to a Medicare Advantage plan. I'm talking about going to a high deductible, higher premium, lower premium plan to pair with Medicare. You need to be careful because Medicare Advantage might reduce your premiums, but it might have limited rural networks. And that's a bad thing to find out when you're sick. Okay. Compare those plans, especially during open enrollment and especially when you're alerted to any network changes. Review telehealth and remote monitoring coverage as these services expand in rural systems. Katelyn, it's an astonishing time right now. We know this on the inside. I haven't really talked about it on the podcast. My wife had a knee replacement last year, and it was able to report how she was doing to her caregiver. We had to set up a little modem in the house. And so she was always getting praise for properly doing her PT and things like that. So these are the things that are coming that are going to potentially be very impactful for rural areas. Okay. So annual plan reviews are important as those rural provider networks evolve. But also, you need to plan for consolidated or loss of service. So identify the next nearest hospital with key specialists, understand referral pathways if local services close or change. Keep your medication list and your medical power of attorneys up to date, keep them in a file, and have them ready to go with you. So if you have to go to an emergency care place outside of your local area, they may not be talking to your other hospital right away. So have that with you. It's a good practice. And if hospital closure rumors emerge, consult your primary care provider about referral alternatives. So should you relocate for better access if you're already there? Again, Measure twice, cut once. Evaluate physician availability, hospital quality scores, insurance network strength, distance specialists, and overall living costs. And also, how close is it to your family? Extended visits provide better insight than short trips. So what do I mean by that? If you're thinking about another area, don't just test it for a weekend. Okay. You might want to stay there for a week or more and schedule some routine medical appointments while you're there to see what you think of the area. So the biggest thing, don't run based on headlines. Okay. The Rural Health Transformation Fund creates opportunities, but outcomes depend on local implementation. National funding announcements may not reflect what's actually going on in a given area. So all of our folks should verify local developments, maintain backup care plans, and review coverage annually. Okay. And Medicare decisions become increasingly important as rural healthcare delivery and provider networks evolve. This is something that's a real challenge, and it's because in our system, we pay for service. And if services drop, that's less money coming into those hospitals. So it's a real catch-22. But I think this is a step in the right direction. And Katelyn, it is my hope that if you decide to retire many decades down the road from your local area, that you're always going to have a great hospital within easy distance. So that's what I got.
I hope so. My favorite hospital here is actually about 20 minutes down the road. We have one nearby. It's not my favorite. So I prefer to go to the one that's, just a quick little trip. But it's so true. Like, that article really gets at the heart of something that I think a lot of folks who are looking to kind of destination retire deal with. I have some clients who I absolutely adore working with, wonderful clients. They decided to move to a rural area that is very pretty and very spacious, but I think they found when they got there that having to literally traverse a mountain to get healthcare is maybe not the best idea in your 60s, 70s, 80s, 90s, and so on and so forth. So something to think about.
So Katelyn, tell us about this whole backdoor Roth thingy.
Yeah. So speaking of your 60s, well, less so 60s, but maybe 70s and 80s, and also healthcare, right? Roth money, right? Roth money is normally longer term money. Not always. It can be used in high tax environments, but Roth money, a lot of times folks are leaning on for their long-term care costs, higher healthcare costs and expenses in retirement in those later retirement years. So in a way, certainly not the only way, but a way that you can get money into your Roth is something called a backdoor Roth. Now, this is something that used to be very niche information. I would say as early as maybe like 10 years ago, you really didn't hear this unless it was coming out of the mouth of a financial advisor. Nowadays, though, we hear about backdoor Roths all over social media, on your Reddit, I think I even saw somebody talking about backdoor Roth on Instagram the other day. So it has kind of become a commoditized term, which is, Dan, and my reaction to that is a little bit terrifying because it's a really complex, high-level tax planning strategy that you can screw up and screw up bad. Oftentimes you can screw it up and not even realize that you've screwed it up. So what is it, right? So many of you may know that there is an income limitation to funding a Roth IRA directly. Let me be clear, Roth IRA, not Roth TSP. Roth TSP, no income limitation whatsoever. Roth IRA comes with an income limitation to funding it directly. And those limits for 2026, if you are a single filer, your modified adjusted gross income needs to be under $153,000. And if you are a joint filer, your MAGI needs to be under $242,000 in order to make a full Roth IRA contribution. What do I mean by full Roth IRA contribution? Well, I mean if you're under 50, $7,500. If you are 50 or older, $8,600. Okay? So what do I do if I make too much stinking money to put money into my Roth directly? The reason that I keep using that directly, right, is because this sort of limitation was introduced to keep very wealthy people from stuffing money in Roth IRAs and never paying taxes. Stuffing money in Roth IRAs, having them appreciate wildly, passing them on from generation to generation and never having to pay any taxes, right? But what do the wealthy do when constraints are introduced? They pay really smart people like me and Dan to find ways around it. And that's how the Backdoor Roth was born, really, truly. The process essentially is you make a non-deductible contribution to a traditional IRA. Okay. So you put money into a traditional quote unquote pre-tax IRA, but you don't take a deduction on your taxes for that contribution. So that is an after-tax contribution. And then once that money posts to the traditional IRA, you want to convert it over to Roth. Ideally, you want to do this immediately because you don't want to have any growth in that traditional IRA because guess what? Growth in a traditional IRA, always taxable, always taxable. So if I'm putting $7,500 into a traditional IRA, I want to convert exactly $7,500 over so that I don't have any taxes additionally due. If I invested that $7,500 in the IRA and it grew to $8,000, well, then I'd have to pay taxes on $500. And who wants to do that? So that is basically how it works. You plop a non-deductible contribution in a traditional IRA, you convert it over to Roth. That money is after tax. The growth in the Roth subsequently is tax-free. Now, documentation-wise, both steps have to be reported on the IRS Form 8606. What does the IRS Form 8606 do? Well, it tracks your after-tax basis and prevents any double taxation on those Roth funds, okay? So when you are doing a backdoor Roth, you want to be very, very, very careful not to mix funds. What do I mean by mixing funds? If I have a traditional IRA that has $100,000 in it, and I make my $7,500 non-deductible contribution into that $100,000 IRA, well, I have just mixed funds because $100,000 of those dollars and their growth is pre-tax, and my $7,500 non-deductible contribution is after tax. When I go to convert, now I've got a mess because which money is it that I'm converting? There is no way to specify that I specifically only want to convert my after-tax dollars because the IRS is going to aggregate your balance across your traditional IRAs when you are calculating taxes on conversions. Now, if you are a self-employed person and you've got SEP IRAs and simple IRAs, that could add additional complications. So be aware of that. But when you're calculating the tax that's due on the amount of the conversion from IRA to Roth IRA, if you've got any other traditional IRA balances, doesn't matter if they're with a different custodian. You can have an IRA at Fidelity and an IRA at Vanguard. The IRS is going to aggregate the balance across both. Okay, so existing pre-tax IRA balances can make part of your conversion become taxable because, again, they're not pulling just the after-tax dollars. Here's the simple way to get around this. Don't do a Roth conversion if you have a big old traditional IRA just sitting there. Maybe it's not the best option for you. Maybe there are other options, right? If you've got Roth TSP and you're not maxing that bad boy, I would say that would be option numero uno because we can max out a Roth TSP no matter what income we're making. Other options could be looking towards a spousal IRA for your spouse. Maybe you've got a big traditional IRA balance, but your spouse has no traditional IRA balance. Boom. They could maybe be looking at doing backdoor Roth contributions. You can look at doing some tax modeling to help clarify things. You can always, I will always recommend getting a qualified accountant on board to help with strategies like this that are higher level tax strategies. But in general, if you got a big old traditional IRA balance, backdoor Roths may not be the thing for you. You could still look into it, confirm that it might not be the vibe, just as somebody who's been doing this for over a decade. Another thing I want to make sure that we mention are some rules that go along with the backdoor Roth. Roth IRAs, if you are a frequent attender of our webinars or you're a frequent listener of our podcast, there are 5-year rules with the Roth IRA. So you've got two. You've got an earnings rule that states that Roth IRA earnings become tax-free after 5 years and a qualifying event, which is turning age 59 and a half. So in order to pull my earnings in my Roth IRA out tax-free, I've got to be at least 59 and a half, and that Roth has to have been open for at least 5 years, okay? The second 5-year rule is the conversion rule. Each Roth conversion that you do has its own 5-year period before the converted principal becomes penalty free if you're under age 59 and a half. Okay. So you want to be mindful of that. The backdoor Roth is effectively a Roth conversion. So keep that in mind. Also, and this goes with any financial planning strategy that you're maintaining, you want to keep documentation for the contributions that you've made, the conversion dates, and the Form 8606 filings so that you have crossed all your T's and dotted all your I's. Okay. If you're working with somebody as a financial advisor, they're keeping track of all that, or they should be, right? That's a big benefit. We always say not everybody needs a planner, but everybody needs a plan. If you are the everybody needs a plan, that means you're keeping all of your documentation. So make sure, again, that you've got a handle on that. If you don't want to do that, you could look into working with somebody. That would be a good reason to get a partner there. So again, if we are not maxing out our Roth TSP, but we want to start looking at doing backdoor Roth contributions, then make a whole lot of sense. A lot easier to do your Roth TSP than to be doing something different there and then doing a backdoor Roth. If you are maxing your Roth TSP, you could absolutely throw a backdoor Roth on top of it. More money into Roth when you are in a lower tax bracket due to either tax brackets being historically low like they are right now, or you making less money than you will in the future could be a good idea. Okay. So again, just to kind of sum things up here, backdoor Roth can be a really good idea, particularly in historically low tax bracket times like what we're in right now under OBBBA. I always tell people tax brackets, we don't have a crystal ball. A lot of people think I'm not going to, going back to my original, comment that I had made to Dan, right? When I moved to my field in the middle of nowhere, I'm probably not going to spend a lot of money. And that means I'll be in a lower tax bracket. However, I could drop tax brackets due to income and the government could simply raise all of the tax brackets across the board. And all of a sudden I'm in the same tax bracket or a higher tax bracket. And the funny thing about that is they can do it at any time. So you can retire thinking you're going to be in one tax bracket. And then the very next year or 10 years later, they could change the tax brackets entirely. And all of a sudden you're in a really high tax bracket. So how do we plan for that? We plan for all outcomes. So we have some Roth money, we have some traditional money, and we have some brokerage money. And we pull from those three buckets as we see fit to optimize whatever the tax bracket situation is at present and in the future. So obviously backdoor Roth is going to help you by building up that Roth bucket. A lot of the feds that we see, particularly the ones who are approaching retirement, are often undersaved where Roth is concerned. And so a big concern is trying to bump up that bucket. Situations where you ought to think twice. I mean, you should always think twice about an advanced tax planning strategy like this, but particular situations in which caution may be warranted if you've got existing pre-tax IRA balances. You don't want to trigger the pro-rata taxation. It really sucks. Don't do that. You may have an unexpected tax liability with this, right? Because you are converting money over to Roth, right? Especially if you are not funding a pre-tax IRA and doing a backdoor Roth instead. That could create additional taxes for you. Be aware of that. Be aware of those 5-year conversion rules. Okay, so we're not converting money that we're going to be using next year. This is a longer term strategy. And then also just that Form 8606, that thing's got to be filed. If you fail to file it, you can really create some future reporting complications with that. So backdoor Roth, like so many things, should be part of an overall strategy that is based on your own unique financial planning goals and values. We always say, again, not everybody needs a planner, but everybody needs a plan. And that I will double down on that for backdoor Roth. You need a plan with backdoor Roth, and you need to understand how it fits into the overall strategy, because what is a good idea this year might not be a good idea next year. I'll give you an example. If tax rates double, backdoor Roth might not be a great idea for quite as many people as it was before, okay? And that can happen at any time. Overall, you want to make sure this strategy aligns with your overall TSP allocation, your overall retirement plan, and your financial context. And again, I will say, professional tax or financial planning analysis is probably a good idea before executing any kind of Roth conversion, and that includes a backdoor Roth conversion.
Couldn't agree with you more. And Katelyn, I got kind of a cool idea for something down the road. I think we need to have like a cage match between Backdoor Roth
Mm-hmm.
and healthcare HSA.
Oh, Backdoor Roth and HSA. Oh, I would be so conflicted. I don't know who I love more.
No, I'm digging it, man. It'd be like one of those battle raps.
Yeah.
You know, they can each get up there and make their case.
HSAs and Backdoor Roth, like really Roth conversions in general, because I just love a good Roth conversion in the morning.
Yep.
You know what I mean?
We'll kick that around.
Yeah. It's the love triangle for the ages.
Indeed.
All right, everybody. I think that is going to be a wrap for this episode of the Fed15. Yeah, but we'll be back next week because I can't retire to my field in the middle of nowhere just yet. So we're going to be back to bring you all the latest updates that you need to make informed decisions about your career and financial well-being as a Fed.
And be sure to subscribe to this podcast, whether it's on YouTube or Spotify, so you never miss an episode. But also that helps us amplify the signal. If you've watched this and you haven't subscribed yet and you do it, that's sort of casting your vote that YouTube should show it to more Feds. And that's what we're going for. Now, maybe this whole thing about rural healthcare wasn't a big thing for you, but chances are good there are Feds that it will impact and they're not going to get anywhere else. So please help us out with that. And please share this with your friends and colleagues.
Absolutely. If you've got a friend out in the sticks, go ahead and send them this episode. We love them. For more information on the topics that we covered in today's show and so much more, be sure to check out our blog at blog.stwserve.com. While you're there, you can subscribe to our newsletter, The Weekly Serving, to get all the latest news for Feds delivered straight to your inbox every week.
And Katelyn, don't forget those live webinars that we do every single month. And we've got some really good ones coming up. We've got our ever popular financial planning webinar that'll go up on April 22nd. That's from 1 till 4. Ed Zerndorfer is presenting. I'll be hosting. And then about 6 days later, we've got our incredibly popular FEHB, Medicare, and TRICARE webinar. That'll go up on the 28th from 10:30 to 2:30. And yes, you've got Ed and Dan again, so you're stuck with me 2 times in a row. But I promise Ed's worth it. And if you prefer a more personalized one-on-one explanation approach, things like that, you can hit us up at meetings@stwserve.com. We are happy to help you any way we can.
Yes, we are. So thank you very much for listening to this episode of the Fed15. I am Katelyn Murray.
And I am Dan Sight.
And we will see you next week.
We will. Can't get rid of us.